Google Flu Trends, a web-based tool for influenza surveillance. Data from search engine queries provide a wealth of information that can be used in conjunction with traditional forecasting methods. For instance, the Google tracking function called Google Insights was recently used to indicate a trend in initial claims for unemployment benefits 7 days before the government announced the official figures. Web search queries provide a valuable source of information on collective health for data mining. Recent studies have shown that patterns of searches related to healthcare-seeking behavior were able to detect regional outbreaks of influenza 1 to 3 weeks in advance of official flu surveillance data, which was provided by the Center for Disease Control. As a result of Google's research efforts in this field, the company has been able to launch a tool for near real-time detection of influenza outbreaks. Google Flu Trends provides a web-based tool for detection of regional outbreaks in the United States and is being evaluated by the CDC. The CDC publishes national and regional weekly influenza statistics derived from laboratory and clinical data. There is usually 1 to 2 week lag in reporting an influenza outbreak. Thus, the CDC Influenza Surveillance Program identifies outbreaks as they occur and doesn't provide advance warning. In addition to influenza surveillance, the CDC uses syndromic surveillance, such as analysis of over-the-counter medication sales and school absentee records. Syndromic surveillance is surveillance that uses health-related data that precede diagnosis and provides a significant indication of an outbreak. Analysis of trends in health-related internet search query logs could serve as a supplement to the currently used forms of influenza surveillance. With increasing international concerns about new infectious diseases, pandemics, as well as bioterrorism, there is a need to alert public health care practitioners and clinicians regarding an outbreak as early as possible. Current methods are unable to characterize the sensitivity and specificity of an emerging outbreak or bioterrorism attack. In addition, Homeland Security Presidential Directive 21 calls for a biosurveillance capability that integrates and efficiently manages health-related information across a wide range of information systems during an event. HSPD 21 mandates that all sources of biosurveillance information be incorporated into policy decision-making. Hence, tools such as Google Flu Trends might play a role in the implementation of HSPD 21 and public and government health policy. In order to reduce the mortality and morbidity of influenza outbreaks, near real-time surveillance is needed. This would help to assist health care practitioners to institute control measures in a timely fashion, as well as find cases and provide access to adequate treatment. Surveillance tools, such as Google Flu Trends, has the ability to predict population-based events for public health purposes, as well as longitudinal data on health information supply. Thus, this information serves as an important component of infodemiology. Infodemiology is the study of the determinants and distribution of health information in an electronic medium to inform public health and public policy. The audience of this paper is public health care practitioners, public policy makers, and medical professionals. Its purpose is to introduce the audience to Google Flu Trends as a tool to track influenza activity and show how other diseases of interest may be tracked using the more generic Google Trends. Studies associated with this type of tool, as well as how data are processed via the Google Trends website interface, strengths and weaknesses, and potential uses of this type of tool will also be discussed. 2 studies primarily associated with surveillance of health-related web search engines were done using Yahoo and Google search engines. The Yahoo study by Paul Green et al. Examined the relationship between web queries in the United States that contained influenza-related search terms from the Yahoo search engine from March 2004 through May 2008 with the actual occurrence of influenza. Linear modeling was used to predict the percentage of cultures positive for influenza and deaths attributable to pneumonia and influenza in the United States from counts of specified search queries divided by the total number of searches. The models predicted increases in cultures positive for influenza 1 to 3 weeks in advance and increases in mortality attributable to influenza up to 5 weeks in advance. In February 2009, Ginsberg et al. Published a study in Nature describing a method to analyze the large numbers of Google search queries to track influenza-like illness in a population. The results of the Google researchers' efforts was Google Flu Trends, a tool to estimate the current level of weekly influenza activity in all 9 regions of the United States. This automated system used the 45 web search queries that scored highest in a Z-transformed correlation across the 9 regions for influenza-like illness-related search queries. Using weekly ILI percentages between 2003 and 2007 for all 9 regions as a single region independent coefficient is produced for use in the model that allows Google Flu Trends to detect ILI percentages from search query data. The researchers used Google tools to generate ILI estimates throughout the 2007 to 2008 influenza season. They found that Google Flu Trends was able to consistently estimate the current ILI percentage 1 to 2 weeks ahead of the publication of reports by the CDC's U.S. Influenza Sentinel Provider Surveillance Network. There is some controversy surrounding this study. Google has been reluctant to share search data with external researchers so that the results of the Google study can be replicated. Additionally, since Google Flu Trends is owned and operated by the Google Corporation, the objectivity of this study by Ginsberg et al. Has been questioned by some researchers. However, the results obtained by Google researchers seems to be confirmed indirectly by Eisenbach et al. At the University of Toronto. Investigators purchased an ad from Google that pointed users searching for flu-related terms to a flu educational website. It was found that the patterns of clicks on the advertisement predicted influenza cases about a week in advance of the official Canadian Flu Watch report that reports on influenza-like illnesses observed by Sentinel physicians. In order to increase the scope of Google Flu Trends' ability to estimate the level of influenza activity in near real time, Google.org has released Google Flu Trends on a global scale. In October 2009, Google Flu Trends has been released for 14 countries in Europe. In total, Google Flu Trends covers data for 20 countries worldwide and is available in 37 languages. Several studies have been undertaken to examine the relationship between the results from Google Flu Trends and existing surveillance systems outside of the United States. In New Zealand, Wilson et al. Compared patterns from GFT with 2 independent national surveillance systems for ILI cases during the period of pandemic spread of H1N1 influenza. The researchers found that the patterns from GFT were closely associated with the data reported by the national surveillance systems, usually peaking a week before and a week after the officially reported cases. Research on populations outside of the United States comparing search trends based on Google queries related to influenza and other infectious diseases have resulted in results similar to those found in the aforementioned studies. In France, Pellet et al. Compared search trends based on Google queries related to ILI, gastroenteritis, and chickenpox with clinical surveillance data from January 2004 to February 2009 and found that the peak of the time series of Google queries occurred concurrent to the disease indices. In Spain, researchers compared the Google queries used by Pellet et al. To disease reporting by the Spanish National Epidemiology Center website and found maximum correlation 2 weeks before the declaration of an ILI, such as gastroenteritis, influenza, or chickenpox. These studies further point to the potential of Google Trends to predict influenza outbreaks in non-English-speaking countries.